Do you ever feel that your neck is locked up and it just needs to move, but it won't? In this video, I'm going to show you how to safely self-mobilize your neck. For this video, you're going to need a belt or a small hand towel. Stay tuned. Thanks for tuning in again. My name is Dr. Jon Saunders, and if you're like me, I know there's certain times when you're at home, you're working on your computer, or you've been working to sustain posture, and your neck just feels stiff. Not only will these movements release the tension in your neck, they're gonna help you with your neck pain, with your stiff neck. They can help relieve cervicogenic headaches, and even if you're suffering from cervical vertigo or cervicogenic dizziness, these self-mobilization techniques might just help give you the relief you're looking for. And remember, never push into pain. You can push into a stretch, but this should not irritate an underlying condition. And as a disclaimer, always check with your healthcare provider before applying any of these techniques to make sure they're okay for you. The first self-mobilizing technique I'm going to show you is rotation. So get out your belt or small hand towel that will have an edge that's going to go right at the base of our skull. Our focus is going to be at the base of our skull, as this is where most of the motion, well over 50% of flexion, extension, and rotation happen, and they have the highest percentage of mechanoreceptors in the upper neck that will give you the most effective stretch and relief of neck pain, headaches, or dizziness. So the first thing we're going to do, we're going to take our belt or our towel, the edge of the towel, we're going to come in just underneath the occiput or underneath the skull, and we're going to pull one side down, and we're going to pull the opposite over our cheekbone very gently, and we're going to rotate. Feels really good. We're going to hold this for 5 to 15 seconds and then come off. You can go back and forth, or you can stick to the same side, but for this video I'm going to show you the other side as well. So again, come across the cheekbone, zygomatic arch, and we're going to place this hand, it's kind of just a pivot point, and we're going to rotate in as far as you can go without causing pain. Let me also show you with a towel. So we're going to take the edge of the small towel. We want to get it right in the base of the skull, almost like a cape here. Pull one side down along the cheekbone and rotate through. You should feel some tension gathering the further you go. Again, don't push into the pain, but push into the restriction just so it feels like a good deep stretch. You should try to do 3 to 6 on each side, holding anywhere between 5 and 15 seconds. Next, we're going to move into flexion extension. If you like the towel, you feel more comfortable, stick with the towel. I'm going to use the belt through this video. And for this one, again, we're going to drop right off the occiput, just pull it off into the meaty part of the suboccipital area. We're going to put a little bit of forward pressure, and for this one, we're going to take our chin, and as we tuck it, we're going to look down and hold 5 to 15 seconds, and then relax. Again, we're pushing through forward with our hands, just underneath our skull in our suboccipital area. Again, we're in chin tuck and look down. Put a little force through. What you're trying to do is you're going to feel an elongation stretch in the back of the CO, C1, C2 area, the upper cervical spine. And then we're going to do the same thing for extension. Forward pressure right underneath the skull, and we're going to come up as we pull. You'll notice that I like to let my jaw, I don't like to keep my jaw shut like this. I find it decreases my range of motion, so just let it relax jaw. It's got a release there. So some of these you might get a release in. Don't try for the release. If it happens, it happens. But don't force anything. If you force something, you're going to get yourself into trouble and you're going to irritate your neck. Okay, for one last one, we're going to do a lateral stretch of the side of the neck. We're going to self-mobilize both sides in order to complete the flexion extension, rotation, and lateral flexion self-mobilization. For this one, we're going to lie on our back. And the reason we want to lie on their back for this one, it allows us to really relax the muscles in our trapezius, our scalenes, all the neck and shoulder muscles want to be relaxed for this one. And for this one, we're just start with our hands to our side, and we're going to stretch the left side here. So what we're going to do, we're going to take our shoulder and depress it. So you want to reach down on the table. Then we're going to take our head and we're going to laterally flex away. And we're going to use our hand to do a bit of help. And then as we start to feel that stretch, this might be all you need. If you need a bit more stretch, you're just going to rotate your head to the left side. You're really going to feel that through this section. You want to hold this for about 15 seconds. And again, you just slowly, you're not going to jerk this, you're going to slowly pull into that mobilization / stretch. And you might feel some release here. Don't go for a release, but if you do, it'll be relaxing, but I don't want you to force into pain. And the same thing we're going to do, balance it out on the opposite side. We're going to take our right shoulder, we're going to reach down the table or floor, wherever we are, opposite hand. We're going to laterally flex our ear to the shoulder, and then we're going to rotate to the right side. You're going to rotate to the side you're stretching. Feels amazing. Again, hold anywhere between 5, but preferably up to 15 seconds. Very controlled. Don't jerk it. Don't pull too hard, just until you get a good stretch. So just to summarize, you can use a small hand towel or your belt like I used to demonstrate these self-mobilization techniques. We start with rotation on both sides, flexion, extension, and then we lie down for the supine lateral flexion mobilization. Let me know in the comments below which one you felt was the most effective for you. If you're new to my channel and like the content I'm putting out, maybe you'll consider subscribing so you can be informed when I upload a new video. Thanks again for tuning in. I can't wait to see you in my next video. Until then, stay well.